The following program is sponsored by Community Psychiatric Centers and is produced for educational purposes only. It is not intended as a substitute for medical or psychological advice, diagnosis, or treatment. The content should not be used for self-diagnosis or treatment of any health-related condition. As always, seek the advice of your healthcare provider with any questions regarding a medical or mental health condition.
Welcome to Community Psychiatric Centers Presents. You've heard the headlines. The rate of autism among our children continues to rise. But what's behind it? Genetics, a vaccine, or some other toxin? If you're a parent, you may feel lost in a sea of controversy and confusion. So tonight we'll try to separate autism facts from fiction. But first, let's meet our experts. Dr. John Carasso is Clinical Director of Community Psychiatric Centers. He's a clinical licensed child psychologist and a certified school psychologist. And Dr. Robert Lowenstein is Medical Director of Community Psychiatric Centers. He's a board-certified child, adolescent, and adult psychiatrist and a fellow of the American Academy of Child and Adolescent Psychiatry. Good evening, gentlemen.
Good evening.
Dr. Lowenstein, we know that an estimated 1 in every 150 children in this country is diagnosed with autism, but there are so many contradictory claims about what might be causing it. What's a parent to think? What does the latest research suggest?
Right. The actual cause of autism is still unknown. There are many theories and lots of research being conducted currently to try to come up with the reason of the cause for autism, but this, again, is still in a research stage. There are lots of theories about it. They can range from it being due to an infection, such as a viral infection that a child might get at birth or prior to birth. It might be due to a chromosomal abnormality, and there are maybe 20 chromosomes that they're looking at to see which ones could develop or predispose a child to develop this condition. There are genetic factors which all the researchers are looking at, and there are several genes particularly that they're looking at that might cause it. Genes 7 and 15 are the ones that they're looking at. And also, there are structural abnormalities in the child's brain that they're really born with, and there's an overgrowth of the brain prior to the age of a year old, and where the child's brain, certain parts of the child's brain, the frontal part, for example, tends to outstrip itself in its rapid growth and development, and the other parts of the brain that should be developing are not. These are being studied now with lots of brain imaging techniques trying to develop the cause for it, but it's still unknown. Now, we've heard a lot about vaccinations recently in the press, and there are people that believe that vaccinations might in some way cause or trigger the onset of autism. The theory is not that the vaccination itself causes it. At first it was thought that maybe it was due to the mercury that existed in some of the vaccinations, the thimerosal. But that's not been in most vaccinations since 2001, and the rate of autism has continued to climb throughout the world. So it can't possibly be due to that. But still, there's a theory that says that the vaccination itself creates an immunologic stress on the brain of the child, which then causes the brain to swell or to act abnormally, and in such way develop autism.
So parents are really desperate to find out the cause. And there's a lot of controversy, as you all know, about a TV show on ABC tonight that deals with autism and the causes.
Yeah, the problem with this theory is that if parents are convinced that they should not vaccinate their child for fear that the child might develop autism, then they place their child at greater risk to develop measles, mumps, and other conditions which are life-threatening. There have been several deaths in the last several years after parents stopped using some of the vaccinations, so that should be avoided. We've been able to cure polio because of vaccinations, and we certainly don't want that to return.
And so parents are left with a real challenge. On one hand, they want to immunize their child and keep them safe. On the other hand, they don't want to expose their child to some potential toxin. And I would be lying if I said that there wasn't some apprehension even on my part. I have 2 children. When it came time to vaccinate, I did so, but there was some trepidation in doing so. people also have a sense that science at times is not entirely reliable. I mean, how many times have you heard, some statement or position at one point in time and then years later it changed? Like when I was growing up, the whole talk was global cooling. I mean, remember that? We were going to freeze to death. Now it's global warming. Not to get political, but the point being that things tend to change, positions change, and parents are left thinking, what to think, and they're not sure what to do. The research, though, is abundantly clear that there's no connection, and that's the bottom line of the research up to now.
A lot of skepticism about whether the government tells us the whole story, so that might play into it a bit.
Yeah, try not to get conspiratorial, but the fact is that sometimes research findings over the course of time change, and so is this a situation where they're going to change or they're not? Yeah. By all indication, they probably won't. It seems pretty clear cut. The parents are skeptical.
Let's talk a little bit about, we've talked about some of the issues related to the causes, but if there is a child who comes in, what are you looking for in terms of making a diagnosis?
Sure. Autism is considered to be a developmental disorder. So the signs can be evident as early as infancy, but usually it's not diagnosed until much later, maybe sometimes 2 to 4 years of age. Some things that we look for would include, again, things that can be seen at a year-old, 18 months. We get kids in the office at times, again, 12 months of age, 18 months of age. What we're looking for is any number of things that would include a child who has difficulty with pointing or gesturing, has trouble with nonverbal communication. So if it comes time to wave hi or wave bye or point to something, they struggle with that. A child who ignores toys, or they obsess on certain toys. These children want sameness. They want the same thing over and over again. So a new toy is something they're going to rebuff as opposed to the same old toy that they obsess to, or more mechanical toys like Thomas the Train, as opposed to animated objects or toy characters. They tend to, hallmark features, they tend to get bored or demonstrate a lack of interest in conversation going on around them. Even young infants, if there's conversation between two people in the room with them, their eye contact will transition from one to the other person back and forth. With children with autism, that won't happen. They tend to be non-responsive to their name. They have poor eye contact. Parents sometimes think that they have hearing problems. You'll see them staring at their fingers or lights or repetitive patterns. Water out of a faucet is something that they may be obsessed with. There's a sense that they may be slow to develop despite the fact that they could have developed earlier. Children who walk, for example, they walk because they want praise for walking. They want to walk to their parent, give a hug, that sort of thing. Well, children with autism, they may be able to walk, they just choose not to because they really don't want to. The praise doesn't have the impact on them. Or does the hug.
And sometimes children do develop some of these skills, such as communication skills or social skills, only to then appear to lose them around the age of 2. So it's rather disappointing to the parent that the child has progressed. They're beginning to say a few words, they have good social communication, good interaction, and they suddenly begin to lose those things.
Exactly.
Their bowel training is also lost at that point, and it's quite a traumatic event for the family.
So it's regressing.
It's totally regressing.
But that regression is a real red flag, no question. These children may also enjoy various games like chase, and they may enjoy tickling, but when it comes to more intimate activities like peekaboo or pat-a-cake, that they won't have an interest in.
All right. We were talking about some causes and other issues related to autism. When we come back, we'll take a look at treatment. If you have a question to ask our doctors, you can always log on to their website, which is cpcwecare.com. We'll be back with a look at treatment right after this. Stay with us.
Have you noticed something different about your child lately? Does your child seem withdrawn, unhappy, depressed, or prone to sudden outbursts? Your child may be suffering from a mood disorder, and it may be time to get help. At Community Psychiatric Centers, Dr. Robert Lowenstein and Dr. John Carasso lead a highly trained professional staff that offers mental health diagnosis, treatment, and therapy to children and adolescents. Call 1-877-899-6500 today for a free phone consultation.
When you watch Channel 11 News 11 at 11, we bring you straightforward local news that doesn't waste your time.
News coverage you can count on.
And welcome back to Community Psychiatric Centers Presents. We're talking with Dr. Robert Lowenstein and Dr. John Carasso of Community Psychiatric Centers about autism tonight. Dr. Lowenstein, what does the assessment entail to determine whether a child indeed has autism?
Well, it has to be a comprehensive assessment. First and foremost, the pediatrician involved in the case should, at a very early age, begin to do a screening of a young child under the age of 18 months and probably do 2 or 3 screenings by the age of 24 months, looking for some of the signs that we talked about in the last segment: social interaction, communication, those kinds of things. They also should do a head circumference measure of the child to see whether or not the head is growing abnormally large under the age of 1 or 2. They need to do a lead toxicity screening to rule out the presence of lead toxicity. And then the testing for autism can proceed more from a non-medical perspective, and doing tests like a functional analysis of the child's behavior needs to be developed, which is a description of the child's behavior. There are screening tools which can be used to help detect the presence of autism. There are a bunch of rating scales which are quite good. Some of them are very complicated and take a long time to do. And then the observation of the child is very important, getting as much history as you can from the parents and from other people that spend time with the child. And all of that taken together helps to make the diagnosis and to rule out other diagnoses, because there are other conditions that can look like autism but are not, and there are other conditions which can accompany autism, such as ADHD, which needs to be ruled out in as well.
Dr. Carasso, once the diagnosis has been made, can you take us down the road of the treatment process?
Sure. And as Dr. Lowenstein mentioned, the treatment process is based in the evaluation. That's why it's so important to have an experienced and well-trained practitioner, psychologist, psychiatrist conducting the evaluation, because that's where the treatment process is based from. It starts with a comprehensive treatment plan based in any number of modalities. First and foremost is just the process of developing a strong rapport between the therapist and the child, and there's very specific strategies to make that happen. From there, the bulk of the techniques are typically based on something called applied behavioral analysis. The foremost intervention based in that strategy would be discrete trial therapy, which is a very regimented approach to provide specific skills for children. There's applied verbal behavior, which is a reinforcement program to elicit verbal communication from children. There's RDI, there's PECS programs to help children with communication. It's referred to a picture exchange program to help children, again, communicate if they can't do so verbally. We're going to work on play skills. Children with autism struggle in terms of being able to play. Oftentimes they don't know how, but they can learn, and so that's a big part of the treatment process as well. There's also we want to divert the self-stimulatory behaviors, so we're going to focus on social skill development through role plays and Greensplan floor time methods, and so it's a multimodal approach to address the multifaceted problems that these children face.
Also, some of these children have problems because they have problems with speech. They're given speech therapy and they need to be assessed by a speech therapist. Sometimes when they appear not to hear, they need to have a hearing test done to rule out the presence of a hearing disorder, and also to receive occupational therapy to help them learn certain tasks that they need to develop in their life.
And the key to that is that all these practitioners are working together, because we don't want splinter groups all over the place. So the something called wraparound services, which is an intensive service where the therapists go to the child. They can work together with the speech therapist, an occupational therapist, and whoever else is working with the child to have an integrated, cohesive team.
Let's talk about community psychiatric centers. Do you have all of the above, everything that you mentioned, or do you specialize in a certain area, or is it?
Well, we do have professionals that work with us in our program that give these kinds of interventions and treatments for the children, and sometimes we do have to refer them to colleagues of us with whom we work to provide things like speech therapy and occupational therapy.
It all starts with the evaluation with Dr. Lowenstein and I conducting evaluations on children with autism and to make an accurate diagnosis, and then our staff providing wraparound services going to the homeschool community to provide the support.
What about other dietary and other types of intervention, dietary restrictions?
Yeah, there are other types of interventions which are called the biomedical or complementary interventions for the treatment of autism. They can include the use of vitamins, the use of supplements such as omega-3 fatty acids, special diets that include casein-free and the gluten-free diets, which are probably the most popular type of alternate type of intervention. A lot of families try it, and some of them do report a marked improvement in the child's symptoms with those things not in the child's diet. There are allergic causes. It is thought there are allergic causes, so some of the treatment can involve the avoidance of certain foods which might cause a condition, or hormones are used, and there's something called sensory integration therapy in which the child is helped to deal with their sensory intolerances.
Sounds like there are so many different ways to treat autism. How long before you can pick and choose and sort and try to find out what suits a child the best? Does it really take a while?
It does take a while, and it's a very intensive form of treatment. The earlier treatment is given, the better is the prognosis. If we can start a child in treatment at 2, they do a lot better than if we start them at 6. They need an enormous number of professionals in their lives, including their parents, to help them to improve. And then over time, you're able to add or subtract certain treatment interventions that don't seem to be working or aren't working.
Yes.
So in addition to the child, you really have to do a lot of work with the parents to guide them through this, because if your child is just diagnosed, that has to be so confusing. As we said when we started, just finding out what the causes are, and we don't know yet, but then you're faced with the treatment.
Sure. A big part of it is helping the parent to take on the role of therapist in many respects and carrying out some of these strategies throughout the week, because the therapist can't be there 24/7, and so it's important that the parents involved, and of course the parents that we work with are incredibly motivated, of course, and pick up on these strategies very quickly and prove to be a huge part of the treatment team.
Parents are extremely knowledgeable,
Definitely.
very involved, and do a great job by and large.
It sounds like the discrete trial therapy that you talked about, or treatment, is some of the more common treatments.
Well, probably the two most common, discrete trial and the Greenspan methods, 4-time methods, and they're both very effective. Discrete trial is more regimented, structured, to teach specific skills to children. The floor-time Greenspan methods are more free-flowing, more play-oriented, and working in conjunction with one another. They work very well together and help to supplement one another.
And along with the behavioral interventions, which we're talking about, there also can be the use of some medications, which, while not cure for these conditions, help some of the symptoms that are associated with autism. Some of the major tranquilizers have been approved in the treatment of autism, particularly in treatment of aggression and the impulsivity that these children and self-abusive behaviors that these children seem to display. We also use the stimulants in the treatment of attention deficit type symptoms and overactivity. Antidepressants are used for the treatment of anxiety. So there's a whole gamut of medications that can be used to help this child.
All right, we're going to take a short break. When we come back, we'll be looking at some other children's health issues in the news. Stay with us. You're watching Community Psychiatric Centers Presents on PCNC.
Every parent has sweet dreams for their baby, but what happens when the unexpected happens? When a child develops slowly, has trouble talking, or withdraws into a world all by himself? Today in America, an estimated 1 in every 150 children is diagnosed with autism. And while there is no known cause and no known cure, an early diagnosis can make a major difference in an autistic child's life. At Community Psychiatric Centers, Dr. John Carasso and Dr. Robert Lowenstein have more than 50 combined years of experience diagnosing and treating many thousands of children and adolescents with autism spectrum disorders. They, along with their highly trained professional and caring staff, can evaluate, diagnose, and treat children and adolescents who may be having problems at home, in the community, or at school. If you believe your child needs help, call 1-877-899-6500 for an evaluation at one of our 11 convenient locations in southwestern Pennsylvania. Community Psychiatric Centers, connecting you, your community, your world, one family at a time.
to Community Psychiatric Centers Presents. We're talking with Dr. John Carasso and Dr. Robert Lowenstein of Community Psychiatric Centers about children's health issues tonight. And let's go to our research corner. Dr. Lowenstein, we'll start with you. Some new research about stimulants, effectiveness, and age of children.
Yeah,
explain that.
There is some understanding that the stimulants, when given to adults, seem to act somewhat don't seem to act the same way as they do with children. For example, some adults, when given stimulants, get high on it rather than get helped by it. And there is some research coming out of Temple that shows that there is a difference the way the stimulants are protected in the brain of young children, that there's a neutrophil factor which helps protect the brain against the addictive properties of the stimulant, and seems to explain why it acts differently in children than in adults.
And so parents can be reassured to some extent that their child may not necessarily, become addicted, and Dr. Lowenstein can speak more on this, the idea that some of the concerns that parents have concerning the effect that these medications will have on their child. Will my child somehow become addicted or become high off the drugs and whatnot? But again, it shows that there's a different effect.
When they're doing the testing to decide whether these medications are going to be used for kids, how do they do these trials on children, or is it trials on adults and then they make this of use to children? No, it's trials with children. Actually, the first trials in children took place in 1938 with Ritalin, and 60-something year history of trials with Ritalin and other stimulants on children. And they do them in a double-blind way. They have a group of children that gets the medication and a group that doesn't, and they compare the two results in a double-blind way. And these studies are long-lasting, and they certainly show that children can benefit from the use of stimulants with ADHD, and that indeed they are protected from becoming addicted to it. All right, let's talk. Here's another one. Dr. Carasso, talk therapy for children's pain. All the kids might have a stomach ache. Exactly. Well, how common is it for a parent to struggle with their child complaining of a stomach ailment? And usually we associate that with avoidant behaviors. The child doesn't want to go to school, and that may very well be the case. However, for kids who have chronic stomach problems, and if there's no medical explanation for it, we do need to take that seriously, keeping in mind that upwards of 25% of kids at any given time struggle with stomach ailments that actually gets in the way of their weekly and daily activities. Also, keep in mind that there seems to be a direct connection between our level of distress, anxiety, and whatnot, and our stomach. Even for adults, if we're anxious about something, our stomach gets a little queasy. People get ulcers, people get any number of bowel problems related to anxiety. And so, even though there may not be a medical explanation, it doesn't mean that the pain isn't real. Well, there was a rather thorough literature review done recently, and some of the more effective strategies were broached and were explained. And actually, quite frankly, this is something that we knew all along. We've been doing this for years, based on three strategies. One is cognitive behavioral intervention to help these children. That's helping the child to think differently about their pain. Relaxation techniques to help them, for example, relax their stomach muscles, that helps the pain to subside. And then thirdly, doing family therapy, because what we found, and we found this ourselves, is that the more distressed a parent feels concerning the child's stomach ailment, the more the child feels pain. So if we can alleviate one, we can alleviate the other, and that proves to be very, very effective. All right, we're going to take a short break. We'll be back with some of your questions here on Community Psychiatric Centers Presents right after this. Stay with us.
As a parent, you want your child to reach his or her full potential. For children with autism, early detection and treatment can make a world of difference in your child's life. At Community Psychiatric Centers, our autism unit is led by two highly trained and experienced mental health professionals, Dr. Robert Lowenstein and Dr. John Carasso. Their expertise in the field of autism spectrum disorders means you and your child will get individualized help you need every step of the way. Community Psychiatric Centers, connecting you, your community, your world, one family at a time.
When was the last time you volunteered for a neighborhood project? Offer a little of your time to make a difference in a teenager's life. With its Together as One program, Youth Places engages at-risk teens in service projects within their neighborhoods. If you're interested in volunteering or donating to youth places, go to WPXI.com and click on the Champion in Action.
WPXI TV and Citizens Bank congratulate our Champion in Action Youth Places.
Welcome back to Community Psychiatric Centers Presents. It's time to answer some of your questions that were emailed into the doctors. Here's the first one. My child has ADHD and his pediatrician is recommending medication. However, I don't want him to be doped up. What do you suggest?
Well, firstly and foremost, I don't think anyone wants their child to be doped up. I don't think the pediatrician would either, or the psychiatrist. But we hear this a lot, that a lot of parents are fearful that the medication could cause them to become either addicted to the medication, which we discussed in the prior segment, or look too doped up. And the answer is, it's really trial and error. Some children do respond to the stimulant medications by looking too quiet and too sedate, particularly in relation to what they looked like before, which is concerning to the parent. And if that's the case, the medication can be tapered down or changed. Some children became increasingly agitated on the medication as well, and that also could call for the medication to be changed. There are non-stimulant medications which can also be used, such as Strattera and others, which are not addictive and could be helpful.
So they have to be monitored pretty closely on everything. All right.
And the vast majority of times, kids respond really well to these medications, and it's just the opposite of being doped up. They're more responsive and alert.
Yes.
All right, here's another email question. My child is only 1 year old. Can I tell if he has autism at this young age, and what would I be looking for?
First and foremost, this is no time or place for guesswork. If there's concerns, the parent really needs to bring the child in for an evaluation and have us take a look at this situation. Because there are some things we would be looking for, and there are some signs we can discuss, but really the idea is not that the parent takes this upon themselves, but that they bring them in for an evaluation so we can assess the child. But again, as we discussed earlier in the show, level of responsiveness, eye contact, gestures, social things referred to as social reciprocity and theory of mind, and the children, are they playing with toys? Are they obsessing on toys? Are they just spinning objects? Are they when they're watched by, whether it be the parents or the relatives, are they raising an eyebrow, thinking that this isn't quite usual, but the way the child's playing? They're not really showing imagination. They're just stacking or lining up objects. Things of that nature raise a red flag and a reason to bring them in. But I can't tell you, there's plenty of times kids come in for evaluations and, listen, the child's not autistic. Just do some things here and there and they'll be fine. But there are times where there are concerns. If they're addressed early, they can be treated and the outcome's much better.
All right. Thank you both so much for being with us. And thank you for watching. We will see you next week on Community Psychiatric Centers Presents. Thank you and good night.